They announced today that there was an issue on the J&J vaccines. There are three types of vaccines: Pfizer, Moderna, and Johnson & Johnson. Johnson & Johnson is the vaccine I took. It has significant benefits because it's one shot. The other vaccinations are two shots. So somebody such as myself, a little lazy, if I can get away with one shot, I'll take the one shot rather than go for two shots. They have put a pause federally on Johnson & Johnson because 6 people had an adverse reaction to Johnson & Johnson. I spoke to Dr. Fauci and Dr. Walensky, who's head of the CDC, this morning about this situation. We have stopped using Johnson & Johnson in this state, and we're going to use Pfizer and Moderna in the meantime. The situation with Johnson & Johnson is they had 6 people in the country out of 6.8 million who received the vaccine, okay? So it's roughly 1 person per million. All 6 happen to be women. They had blood clots, which are serious, and they had serious headaches. The reason they paused the Johnson & Johnson is they want to make sure all healthcare providers know if a person comes in with these symptoms, the normal medication is heparin that they give for a blood clot. That does not work in this situation. So they want to get the word out to all healthcare providers. If a person comes in, they said they had a vaccine, they have a serious headache, they diagnose a blood clot, you don't use the normal medication. And they have a special protocol for this situation. But context, it's 6 people out of 6.8 million. Happens to be 6 women who, between days 6 and 13, developed headaches. And the federal government, I think wisely so, said, let's put a pause, let's advise healthcare workers to be aware of this, and in the meantime, we'll use Pfizer and we'll use Moderna. So we're going to be doing the same thing here in New York. And then when they finish doing their work on the Johnson & Johnson, we'll resume using Johnson & Johnson. But we do have enough Pfizer and we do have enough Moderna vaccination to keep our schedule and to keep those numbers happening.